Today I'm going to be performing the peripheral vascular exam. Again, before any exam, I wash my hands. I introduce myself to the patient. Hi, Mr. Lane, my name is Nicole Reichert. I'm a CSU and BPA student. I'm going to be conducting your exam today. Is that okay?
Yes.
I'm working in collaboration with PA Mike Jorgensen as well, so we'll be discussing your care right after we do this.
Okay.
Okay? I always do my general survey, observing my patient's general appearance and status, making sure they're alert, they're awake, they're responsive, they're well-developed, well-nourished, and they're in no apparent distress. Again, noting any of those pertinent findings in our general survey, such as posture, facial expression, speech, any kind of dress or body odor as well. I will always make sure I'm verifying my vital signs. If any of them are abnormal, I make sure that I will repeat them as well. So you'll always have your triage sheet to have a reference in the room. So peripheral vascular exam, I start at the top and we work our way all the way down to the lower extremities. So we want to assess major arteries and any kind of vasculature. So the carotids are where we're going to start. So you have a carotid on either side of the neck. I'm always going to be inspecting first for symmetry, scars, and swelling on either side. I'm then going to palpate the carotids so I know where I should be listening appropriately. Please palpate the carotids one at a time. So using my two fingers, I'll be placing them. Would you mind just gently turning your head? Perfect. Excellent. So I'm noting rate and rhythm. I'm going to do it on this side as well. I'm then going to auscultate. Excuse me, I'm listening for bruits on either side. I'm using the bell of my stethoscope. So I'm going to just gently put it over the carotid. So I'm listening for that turbulent flow to indicate any kind of narrowing or arteriosclerosis in the carotids, which I do not appreciate at all. Okay? I'm going to work down to the upper extremities. So we want to check distal pulses. We're going to check the radial arteries on either side. So right just proximal to the base of the thumb with two fingers. We're checking for rate and rhythm bilaterally. You can do this one at a time. You can do it at the same time. It doesn't matter. I'm going to also palpate the brachial artery. So it's on the medial side of the arm, right where you're listening for your blood pressure. Good. On this side. So medial side of the arm, right where you're listening for blood pressure. And again, for rate, rhythm, and quality. And that feels good. Excellent. So, and even before that palpation, I'm always inspecting my upper extremities for symmetry and swelling. And again, the skin exam does cross over to the peripheral vascular system. So we're looking at the skin for pallor, cyanosis, rashes, bruises, any sort of lesions, erythema, ulcerations, and again, hair distribution. So with any kind of arterial insufficiency, you can actually get hair loss on the upper extremities. Excellent. I'm just going to expose your upper arms here. And do you mind if I pull down to look at your chest? Thank you. So we're looking at the hair distribution, color, quantity, and I'm also going to look at the back. Thank you very much. Perfect. Now bring it down to the fingers. After I palpated the pulses, I'm looking for capillary refill. So if your patient has nail polish, this can be difficult, or any kind of artificial nails, but you can give a gentle squeeze for about 2 to 3 seconds and let go, and the blood should return to the distal fingertip in less than 2 seconds, which is a normal finding. And like we did on the skin exam, I want to assess the distal upper extremities and lower extremities for temperature and moisture using the backs of my hands. And I will do the same for the lower extremities when we do the palpation of the lower extremities next. So there is a special test for the upper extremities where we want to check both the ulnar and radial patency. So making sure we have good blood flow to the fingers. And we're going to do it on both hands. What I'm going to have you do is squeeze your hand open and close multiple times, and then hold it for me. I'm then going to occlude both the radial and ulnar arteries on either side. Would you mind opening your hand for me? I'm then going to release the radial side, and you can see how fast the hand pinks up. So I know there's good blood flow through the radial artery. One more time. Squeeze, 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 and hold. I'm going to occlude both. Open for me. And I'm going to let the ulnar artery go. And you can see how fast that pinks up. So now we know we have blood flow from both the radial and the ulnar arteries. And we're going to do the same on this side. So pump, pump, pump. Squeeze. We're going to occlude the radial and ulnar arteries. Open for me, please. And then I'm going to let go of the radial artery while still compressing the ulnar, and you see how this palm really pinks up. So let's do it again for the other side. Push. I'm going to occlude both. Open for me, please. And I'm going to let go of the ulnar artery, keeping the radial artery occluded, and we see good blood flow from the ulnar artery. So we now know both upper extremities are well vascularized with both the radial and ulnar arteries. So that was the Allen test. So then we're going to move on from the upper, and we're going to look at the belly. So I'm going to have you lay down for me, please. Don't forget to pull the bed out to support your patient's legs. And we generally always want to stand on the right side of our examination table. And we're going to be exposing the abdomen. I'm going to move your gown up, or if you don't mind moving your gown up for me, to where you're comfortable in keeping the drape. So all we have exposed is what we're looking at. Excellent. I'm going to inspect the abdomen for any kind of lesions, venous patterns, or color. Then I'm going to be listening for any kind of bruits in the aorta, the renal, and iliac arteries. And again, bruits, use the bell. Okay. So we're going to auscultate the renal arteries just about an inch or two above the umbilicus, and we're going to go on either side of the midline. So that's for the renal. Then just above the umbilicus, right a little bit left to the midline, just slightly, is for the aortic. And below the umbilicus on either side, kind of halfway between the ASIS and the umbilicus, is where the iliac arteries are. So again, listening for any bruits on either side. Perfect. I would also auscultate for bruits for the femoral arteries, and that's a little bit lower into the groin area, but we're not going to be doing that today. We're just going to be verbalizing it. Okay, thank you very much. I'm going to just bring your gown down, and would you mind sitting up for me? I'm going to pull the table in. Perfect. And because we're also listening for bruits in the femoral areas, I would also palpate those pulses as well, just like we did with the radial and the brachial pulses. Okay? So I'm going to be looking at your legs. I'm just going to bring up your drape here. Again, we're looking at the skin just like we did the upper extremities. I'm going to be using the backs of my hands to assess for temperature, moisture, texture, looking at the hair distribution again, looking for especially those ulcerations indicating any kind of peripheral vascular disease at all. We're testing for capillary refill, just like we did in the uppers, by squeezing the distal toe about 2 to 3 seconds, letting go, making sure we have proper blood flow within about 2 seconds. And you can test 1 or multiple toes. Perfect. And it's always nice to get down on kind of this level because then you have a full view of the lower extremities. I want to make sure we're also palpating for edema. So pretibial edema is about right at the distal mid-shin, and you're going to press in for about 2 to 3 seconds, just for like with cap refill. And what we're looking for is any kind of indentation in the skin, which should show for any kind of pitting edema. I usually test in about 2 spots. But you can see he has prominent vasculature here, and we see all the bony prominences, so I don't see any sort of peripheral edema noted. So now that we tested for edema, we looked at the skin, we checked for cap refill. Just like the uppers, we're going to test for our pulses in the lower extremities. So we're going to be testing the posterior tibialis, which is right behind the medial malleolus. I use 2 fingers, and I press. You kind of have to press a little firmly. He has great distal pulses. And a normal pulse, how we document it, is around 2+. 2+ is normal. We want to make sure it's the same on either side. Perfect. And then you have the dorsalis pedis pulses, which is kind of right. I gently dorsiflex the foot a little bit. I use my 2 fingers, and this is a much lighter palpation. And everyone's anatomy is different. Oh, there it is. So we're feeling gently for the dorsalis pedis pulse on either side. Relax your foot. You get good pulses. So I document the posterior tibialis and the dorsalis pedis as 2+ as normal. Now the popliteal pulses, you can have either a patient lying supine, or you can do it while they're sitting down. Sitting down, I think, for me is a little bit easier. What you're doing is you want to cup your fingers like this behind the patient's knee, so making sure they're really relaxed. So coming right behind, and we're pushing kind of towards you, but superiorly just a little bit, and we're feeling for the popliteal pulses. This can be a really difficult pulse to palpate. So if it's a little bit difficult, just get some practice getting behind that popliteal fossa. Now, if they're really bounding and I can really palpate them really easily, I can be concerned for a possible popliteal artery aneurysm, which is when the artery just kind of widens a little bit. Okay. So to check for arterial insufficiency, I'm going to do that last because that requires my patient to lie supine. So first I'm going to be testing for Homans test, which is for a DVT. A DVT is a deep vein thrombosis. They're really common in the lower extremities. Generally, you'd see a unilateral swelling, and you can get distal erythema when there is a clot in those deeper venous structures. And all that is you're dorsiflexing the foot, so gently bringing it up, and it's a squeeze around the calf on either side, and a squeeze around the calf. Now, it's not a very sensitive or specific test, meaning that a lot of people that have calf tightness or tenderness or in the muscle can have a positive Homans test. But if I have concern that my patient has a DVT, it's always wise to document, is there a positive Homans test or not? Okay. So to do both the Berger's test and the ankle brachial index, we're actually going to lay flat one more time. So bring your legs up. So the ABI, we want our patient laying flat for about 10 minutes. So I like to do that one at the end, but to check for chronic arterial insufficiency, we're going to actually lift each leg to about 60 degrees. So you're going to relax. I'm going to be lifting for you. And what this is, it's bringing all that blood from the distal extremity all the way down. And so this is 90 here, so 45 is here, so 60 is around there. Is this comfortable for you? Yep. Now, certain patients, this is not possible, right? If someone has any kind of hip issue or lower back, we don't want to put our patient in pain. So if they are able to do this, it's a really reliable test for chronic arterial insufficiency. So you hold this for about a minute. You work on your upper body strength. And then what I'm going to do is, together, you're going to sit up, and then I'm going to watch the blood flow all the way go down to your toes, okay? So I'm going to move the table in, and then about 10 seconds, we're going to sit up together. Okay, perfect. And we're going to sit up. You can help your patient. And you see the difference in color. This one's nice and pink. This one was a little bit pale. And now the blood flow should start coming back within 10 seconds for the arterial, within 15 seconds for the venous. And that picked up even quicker. We're going to do the other side as well. So laying down. You didn't think you're going to get a workout today, huh? I'm going to hold your leg up. Again, about 60 degrees for about a minute. Get all that blood flow from the distal foot all the way back into the core of the body. Excellent. Okay, and we're going to sit up together. And perfect. And you can see again, the foot is paled up, and within 10 seconds, that foot's nice and pink and symmetrical with the other foot. So having it pink up within 10 to 15 seconds, 10 for arterial, 15 for venous, we're showing there's no chronic arterial insufficiency to the lower extremities. All right, the last one is an ankle brachial index. It's a really fantastic test for arterial insufficiency as well, especially if your patient is unable to kind of do these maneuvers. So I'm going to have you lay down. Excellent. I'm going to grab my Doppler and my ultrasound gel. I'm going to be putting the blood pressure cuff on your upper arm. And relax your arm here. Perfect. I'm going to have the palm facing up. So we're going to get our ultrasound gel, and here's our Doppler. Doppler's super easy to use. Has one button, one probe. I put the gel right at the tip. Okay. I'm going to place this on the table. You're going to feel the Doppler right near your fingertips, okay? What I'm listening for is my brachial. That's a little loud. I'll lower that. There we go. Looking for my brachial artery. And using your fingers to palpate is actually a bit better, because then you can really localize. There it is. A little bit more lateral than I thought. So you hear that whooshing sound? Bump, bump, bump. And you can do this with either a Doppler or ultrasound. Perfect. So what I'm doing is I'm going to pump up the blood pressure cuff to squeeze, and then I'm listening for when that pulsation goes away. So right at 110, that pulsation went away. Perfect. I would let my patient rest for about 2 minutes before obtaining a second one. We want to get 2 readings, and then you average the 2. So let's do the upper again. So it's about 100 and 110. So that'd be an average of 105. So after I do my upper extremities, shut that off. You want to do it on both upper arms, both the left and the right. So right now I'm just documenting the left upper extremity. And you're going to just stay lying down here. And I'm actually going to wrap it around your lower leg. Now you don't have to line it up with anything. So you just put it on the lower extremity. The same size to the upper is fine. Just make sure it's nice and straight. And there are certain patients that you want to be doing this for. So my patient is a young, healthy male patient, so generally elderly patients that are complaining of lower extremity weakness or claudication or pain, you want to rule out any kind of chronic arterial insufficiency. So you can do either the posterior tibialis or the dorsalis pedis, whichever one is easier for you. I think the posterior tibialis is a little bit easier to get, so that's the one I'm going to try first. So you can hear that pulsation on the Doppler. And you're going to feel the squeeze in your lower leg, okay? So it's around 1:30. And the same thing, let your patient rest for at least 2 minutes, and then you want to pump it up again. It's around 1:30 again. Perfect. Shut off your Doppler. Make sure you clean off your probe appropriately. So I will make sure that gets wiped down after this patient. So I did the left side. You do the same thing on the right side. 2 readings in the upper, 2 readings in the lower. And then to calculate your ankle brachial index, you would get the average of the highest number. So this was about 105 in the uppers and around 130 in the lowers. ABI, ankle comes first. Ankle is going to be your numerator. So that was around 130, and you're going to divide it by 105, and you want it to be at least 0.9 or higher to be normal. So he has excellent peripheral blood flow to his lower extremities. His likelihood of having any arterial disease is very, very low. So it's a really great testing tool. Okay, and that is how we do a complete peripheral vascular exam. We will be adding on to this exam, especially with MSK and neuro. That's it. I'm happy to sit up.